Arash and Fatima with us. They recently graduated from their medical school. Now they are planning for the residency in psychiatry. Fatima, do you want to say hello?
Yeah, thank you, Hamid. Good day, everyone. This is Fatima. I am early career medical doctor and researcher, and would very much like to continue my career in psychiatry. I'm currently ISAM General Counsel Officer, taking care of executive tasks and behind the scene, and I'm also involved in related scientific aspects as well. I'm actually looking forward to meeting you all in next ISAM Congress, and I'm really privileged to be, let's say, having this opportunity to be taking part in this initiative, and looking up to all my more senior colleagues in this field. Thank you.
Thank you, Fatima. And Arash, do you want to say hello?
Sure, thank you very much. Hello, everyone. This is Arash. I'm behind the ISAM Gen team mostly. I'm as an assistant officer in ISAM Global Expert Network. I'm really honored to be here with you. I'm already a medical doctor. I'm going to pursue my career towards the psychiatry. I'm also passionate for sure. And I'm looking forward to seeing you all in Istanbul. And thank you very much.
Thank you, Arash. As you can see, I mean, behind the scenes, we just try to engage junior colleagues that they are going to be the next generation of addiction medicine professionals around the world. So if you have kind of medical students, residents who are interested to be a part of the activities that we do in ISAM, please introduce them to us to add them to the network of junior colleagues who are interested to play a role in the next kind of activities that we are going to do in ISAM. So that is going to be an important investment for the future, and hopefully they will have the leadership roles in ISAM in the future. Now we have time to discuss a little bit about what is happening in ISAM, and if there are specific things that you are interested to share or discuss, we'll definitely be happy to have your ideas and your suggestions. Meanwhile, I can see that there are a few other ISAM board members who are here with us. Roshan was here. Roshan, are you here with us right now?
Yes,
I
Hamid.
cannot see Roshan. Yes, okay. Roshan, do you want to say hello and kind of if you want to share anything with us today?
No, I would like to thank everyone for joining this meeting, and I would like to invite you for the ISAM International Congress this year in Istanbul, as well as regional congresses. Thank you for your active participation in ISAM, and I'm happy to
Thank
be
you very
part of.
much. Thank you very much, Roshan, for joining us. And I can see also Amira Khalifa from Oman. I'm not sure if kind of Amira is here and she can kind of say hello. Amira, are you with us right now?
السلام عليكم ورحمة الله وبركاته دكتور حمد.
Assalamu alaikum wa rahmatullah.
And the dear colleagues, really it's an opportunity to be able to join you. Actually, I just finished my clinic and I has the chance to be from the beginning of the starting the meeting, and it was really very informative. And I am looking forward to contact you, Dr. Hamid, for further kind of updates if we can start something in Oman. Because I think we all share the same concerns, and we have the new and old challenges in the field of addiction. And we would like really to play a part in training of medical doctors, because this is the challenge now in the primary healthcare level, in my opinion. We receive the cases very late in the specialized clinics, and the intervention will be very limited because of limited trained doctors, unfortunately. But we hope that by a broad spectrum of training for the junior medical officers in the level of primary healthcare will be of great opportunity to detect the cases early and to try at least to do the basic motivational interview, so that we can have a fruitful outcome from our patients and long-term rehabilitation services of optimum care, inshallah.
Awesome. Thank you very much, Dr. Amira, for joining us. I'm looking forward to have collaborations with Oman. And I can see Rama. I mean, do you want to add any note on that?
Yeah, I'm actually very happy to hear that an Omani colleague is here. So I'm actually raising my hand to say we really need to join forces because the same issues are applying here, I think, in Qatar and also with the Saudi colleagues. So might be very interesting if we can join hands in that. So I'm gonna kind of what do you call it, stalk you or follow you with the email so we can have this conversation as soon as possible. But I had also a question, Hamad, and I don't know if you could help us in that perspective of the group, because we're really interested to look at people who are working with stimulants and methamphetamine committees or groups. I don't know if there isn't a group interested in that specific thing, especially with the cultural differences and how it's presenting itself in different communities. So I don't know which group is and if we can be informed about that.
So, absolutely. As you realize, there has been kind of discussions regarding the potentials for stimulant kind of use disorder treatment, and Yona was presenting the things that they are doing in North Europe, and also there are a few other colleagues from South America that they are interested to stimulant use disorder. So there could be even a potential for developing a specific working group, specifically on stimulant use disorder and treatment and potential challenges that people have around the world. So there are definitely lots of interest on that. Greg, do you want to add anything on that?
Yeah, so in ASAM, they're also developing that particular area of stimulant abuse. And so, Rama, I'm interested with the Doha conference. How do we get more information and get maybe involved in helping and interacting with your group so that we might have a good regional conference in Doha? Can you give us that information or connect with us by email?
Yeah, I'll be happy to do that. As soon as possible. I'll just send you all an email, and then maybe it will be something that we can speak about, because awesome. I think it's something that's
very good.
That is good. And the good thing is Dr. Faisal Al-Harbi from Saudi Arabia, who is the regional representative for West Asia, he's going to also lead the communications in that part of the world. He had an issue with his family today, and he apologized that he was not able to make it for the meeting today. But he's going to be kind of the person who basically connect people, and hopefully there would be lots of collaboration around the Gulf region, and kind of people can do things together. So there are definitely lots of hopes for that. Orgil, do you want to add anything?
Yeah. It is my pleasure to first time this meeting.
You need to mute the other device that you have in the room. So you need to just have mic and kind of a speaker on just one device.
Cool. Hello?
It looks good now.
Can you hear me, guys?
Yes.
Okay, so for Mongolia, actually, so we have Mongolian Association of Addictological Association, but we are not starting well now. So it's the first time we have seen the regional councils, how they planning the ideas and how they doing in this 2004, 2023, 2024, the plans and how the Congress meetings is going. So it's for us, it's a pleasure to listen to everything. So can you guys hear us? Because we cannot hear.
Yes, we can hear you really well.
Okay.
Recording in progress.
Okay. So I'm actually a psychiatrist, so working in a ongoing mental health center. So it's a pleasure to meeting you guys. Thank you.
Absolutely, and we are looking forward for further collaboration. Hopefully, that's going to be a starting point to have Mongolia on the map and having your contribution to the things that ISAM is running. Carlina, do you want to say hello?
Yeah, it's a pleasure being here. I'm representing Alessandra from Brazil, me and Thiago. And I wonder if there is interest in Nicotine Novel Products Committee, because it's a very strong thing in ABIAD, in our association. And we worry about it because there are many novel ways of delivering nicotine, and especially adolescents are being very vulnerable to it. So I wonder if is there any interest, specific interest?
Absolutely. I mean, you can just send us an email. So just to kind of make it clear for everybody who is interested to be part of the process, if you have a society which is interested to be a part of the ISAM affiliation, Atul is the person who is in charge. So he is the chair of the membership and affiliation committee. Atul, do you want to say something about that?
Yeah, thank you. So basically, Hamid, first of all, you and your team deserve congratulations for bringing all of us together and conducting this large workshop with such a diverse representation from across the world. Thank you very much for this. Dear colleagues, thank you very much for joining, participating in the workshop, providing us your very valuable inputs as well as time. As you have already seen that ISAM is really a diverse and vibrant community. So there are advantages galore of being a part of ISAM in the form of being affiliated members of your organizations, your societies, being formally a part of ISAM family. So at this moment, the numbers of affiliated societies, they keep growing. We now have a very systematic process in place. A low-level MOU, societies then need to pay their affiliation fees. And in this context, my request to all those who are affiliated societies, but their membership fees are due, please do look into it so that this engagement continues. We will be in touch with you individually if required to discuss this more about the due payments. For those societies which are here but not affiliated, I would really encourage you to get in touch with us, with me, Hamid, with ISAM general email, anyone, including our president Hamad, and we'll be happy to guide you and welcome you into the fold of ISAM. Thank you very much, everyone.
Awesome. Thank you very much, Atul. And our time is up, so we need to kind of leave. But just kind of answering Carolina's question, we are definitely happy to open up new working groups. So if you are interested to lead a working group, just let us know, and we can work with you, help you to kind of learn how the system works, how you can put people together and make that happen. So that is the plan that we have. You, Rama, others, if you are interested to develop specific working groups and work together around the world, we are here to support you. It was just amazing to have everybody in the meeting today. As you can see here, the next global assembly, the next virtual global assembly is going to happen in a year, in February 25th, 2025. So please mark your calendar for the meeting. And of course, we will have the meeting, the one in Istanbul, that will have the kind of in-person meeting in Istanbul as well. So looking forward to see you guys there, and we will keep in touch. And thank you very much, everybody, for contributing to that. Greg, do you want to say the last words?
Yeah, well, thank you again, Hamad, and all of the participants today. And we look forward very much to continuing our progress and expanding our connections worldwide. And so thank you, and have a good afternoon. Thanks.
Awesome. Have a good one. Take care, everybody.
Thank you very much. Take care.
Bye-bye.
Thank you.
Thank you.
Bye, everyone.